Hello everyone. Now today I'm going to talk about pharmacokinetic calculations और ये calculations based on the pharmacokinetic parameters actually और इसमें कुछ formulas हैं that we are supposed to know because they're asked in the exams quite frequently. So there are few examples which I picked up from the previous exams and from some university papers. And let's discuss those. And इससे क्या होगा कि you will come to know how to use this formulas to solve these numericals. And in the end just we'll brush up और हम देखेंगे कि कौन कौन से important formulas है जो आपको fingertips पे आने चाहिए. So let's get started. This is Dr. Deepikatikoo from Simply Pharmacology. Now the first one here is, if you see here, a person has a bacterial pneumonia and you decide to give him an erythromycin antibiotic by IV route. So remember IV route. The minimum antibiotic plasma concentration which will inhibit the bacterial growth is 20 milligram per liter. And the apparent volume of distribution is 40 liters. So what should be the dose of the antibiotic? ठीक है, so हमें क्या पता है इसमें कि IV दे रहे हैं और जो प्लाज्मा कॉन्सेंट्रेशन है हमारी 20 milligrams per liter है and the apparent volume is 40 liters. And what we want to find out is the dose. So what we have to do here is we simply have to apply the formula जो कि है volume of distribution का. So volume of distribution क्या होता है? This is equal to the amount of drug जो हम देते हैं by the IV route अगर दे रहे हैं and it is divided by the plasma concentration. That's why हम कहते हैं ना volume of distribution और plasma concentration का inversely proportional आपस में रिश्ता है कि जब volume of distribution ज़्यादा है so that means the concentration in the plasma, that means it is less, so it has inversely relation. Now we have volume of distribution with us, we have plasma concentration with us, so we can definitely find out the dose or the amount of the drug that we need to give. So for apparent volume is 40 or what is this one? 20, that is plasma concentration, that is equals to 800 milligrams. So this would be your dose of the antibiotic. So this is very simple. You just have to remember the formula for volume of distribution. Now let's go to the second one. So it's the similar, same है जैसे कि ये वाला है, but the only difference इसमें क्या है कि इसमें हम एरिथ्रोमाइसिन जो भी हम एंटीबायोटिक दे रहे हैं ये ओरल दे रहे हैं, वहाँ पे आईवी था, दिस इज ओरल. एंड अगेन द प्लाज्मा कॉन्सेंट्रेशन की जो डोज है वो सेम है. एपरेंट वॉल्यूम डिस्ट्रीब्यूशन की डोज, एपरेंट वॉल्यूम डिस्ट्रीब्यूशन इज 40 लीटर्स, बट बिकॉज ये ओरली दे रहे हैं सो इसमें बायोअवेलेबिलिटी का फैक्टर भी आ जाता है, दैट इज 25%. So how will we now find the dose? So again we have to apply the same formula. Volume of distribution equals to the amount of drug divided by plasma concentration. तो इसमें एक और चीज़ ऐड करनी है हमने, बायोअवेलेबिलिटी, बिकॉज ये ओरल. अगर आप आईवी में भी सेम फॉर्मूला इस्तेमाल कर सकते हो बट वहाँ पे F इज इक्वल टू 1, ठीक है, बिकॉज वहाँ पे बायोअवेलेबिलिटी मैक्सिमम होती है तो F जो फ्रैक्शन है हमारा दैट इज इक्वल टू 1. यहाँ पे हमने 25% हमने ऐड करना है. अगेन व्हाट यू डू इज apparent volume distribution is 40 multiplied by plasma concentration. How much is plasma concentration? That is 20. ठीक है, and we will divide it by 25% of bioavailability. So this would be how much now for us? This would be 40 into 20 into 100 divided by 25. So 25 into 4 and this is equals to 3200 milligram. So now the dose is 3200 milligrams. So obviously whenever you give a drug by oral route the dose is always more as compared to when we give by the IV route, because oral route say it has to undergo first pass metabolism and therefore we have to take in regard कि जितना loss हो रहा है उसका drug का wastage हो रही है, so we have to give more amount of drug. But IV is directly going into systemic circulation, so वहाँ पे there is no loss by the first pass metabolism, so there the dose would be less. Right, let's come to the third numerical here. So amount of drug A is administered to a patient where it is about 6 grams and its plasma concentration is found to be 80 micrograms per ml. So how much is the volume of distribution of the drug? Again, the same formula. Volume of distribution, this is equal to how much? This is the 6 grams. Okay? So amount of drug already we have 6 grams divided by the concentration is 80 micrograms. The only thing difference is you have to have similar units. तो अगर ये grams है तो इसको आपने micrograms में convert करना है और ये इसको या इसको microgram या उसको milligram आपने दोनों को एक ही यूनिट में डालना. So that is the only thing that you will do. So the same formula you apply here, right? So when you apply the same formula, let's see what is the answer. So here we convert first. So multiplied by, अगर हम इसको 1000 करते हैं, it becomes milligrams. More 1000 करेंगे, it becomes micrograms. So this is 6, 1, 2, 3, 4, 5, 6 divided by 80. So approximately becomes 75,000. ठीक है, it becomes 75,000 micrograms per liter. So this liter, sorry. So ml. So this is your ml. It is in ml because microgram cancel हो जाता है. So what is we are left with is liters only. So ml, sorry. So 75,000 ml is the answer. So again applying the same formula. इसमें सिर्फ ये trick होता है, आपको ये भी देखना पड़ता है कि all your units are in the same, they are uniform. ये नहीं कि कोई ग्राम में कोई माइक्रोग्राम है, वो भी आपको ध्यान रखना है. Next, a patient is going to receive a new drug. The clearance and the volume of distribution is given to you 1.4 liters per hour and the volume is 80 liters. So liter is fine here. What will be the half-life of the drug? Now here what you have to apply is the formula for half-life. So what is the formula for half-life that you need to remember is 0.693 multiplied by volume of distribution and divided by clearance. It's very simple. बाकी सारी values हमारे पास already हैं. So it is 0.693 multiplied by 80 and divided by 1.4. So this is how you will take out your answer. You do the calculations and this is how you will take out the answer. Simple. इसमें सारी की सारी values are on in the same level, uniformity. Then Mr. Mehta is admitted to the hospital with pneumonia. The antibiotic tobramycin IV is ordered. So highlight IV. The clearance and volume of distribution of tobramycin is 80 ml per minute and 40 liters. So here see there is a difference in ml and the liters, right? If you wish to achieve the therapeutic plasma concentration of 4 milligram per liter, how much loading dose should you give? Again, इसमें हमने loading dose का formula apply करना है. It's very simple, right? So loading dose का formula apply करना है. Now loading dose इसमें clearance दी जरूर गई है. So but please remember, clearance और loading dose का आपस में कोई रिश्ता नहीं है. Clearance is important in the maintenance dose, not for loading dose. So here we don't have to worry about the clearance at all. So loading dose का है plasma concentration multiplied by the volume of distribution and you divide by bioavailability in case it is of the oral. अगर IV में है तो ये 1 ही रहेगा. So this is your formula. So plasma concentration that हमें दिया हुआ है यहाँ पे 4 milligrams per liter. ठीक है, this is 4 milligrams per liter multiplied by volume of distribution. So volume of distribution आपका कितना हो गया 40. Now इसमें ये भी लीटर है, लीटर. So there is no problem here. हमें कोई इसमें चेंज करने की जरूरत नहीं है. So यहाँ पे आपका आंसर आ जाए. ठीक है, you can write this 160. ठीक है, would be around 160 milligram. Right. Now let's come to the other one which there is a similar thing but इसमें क्या चीज़ है, इसमें सेम चीज़ें दी हैं, right? Clearance है, volume of distribution same as before, 80 milliliter per minute, 40 liters is your volume of distribution and यहाँ पे हमें मेंटेनेंस डोज कैलकुलेट करनी है इफ एवरी 6 आवर्स में टू मेंटेन द कॉन्सेंट्रेशन ऑफ 4 मिलीग्राम्स पर। सो लोडिंग डोज ने हमें एक स्टेडी स्टेट लेवल आ चुका है, अब हमने उसको मेंटेन करना है बाय गिविंग द मेंटेनेंस डोज। सो हियर यू हैव टू अप्लाई द फॉर्मूला फॉर द मेंटेनेंस डोज। सो मेंटेनेंस डोज का फॉर्मूला क्या होता है, इसमें क्लियरेंस का रोल है, नॉट इन द लोडिंग डोज। सो हियर क्लियरेंस into plasma concentration divided by F. Again, because it's a drug which is given by IV route, so F would be 1, so we don't require this. Now here what you see is clearance. Clearance is given in 80 ml. ठीक है, so 80 ml. So 80 ml needs to be either converted into liters or the liter needs to be converted to ml. Whatever is the थिंग। सो अगर हम 80 ml को कन्वर्ट करेंगे लीटर्स में, वी हैव टू डिवाइड इट बाय 1000 विच विज इक्वल टू 0.08 लीटर। सो इट इज क्लियरेंस इज 0.08 लीटर्स हियर पर मिनट। ठीक है, सो वी हैव द क्लियरेंस 0.08, वी मल्टीप्लाई दिस नाउ बाय 40 liters, right? Sorry, 4 is the plasma concentration of 4. This is what we require. So कितना बन जाता है 0.32. that is what is we have the but this कितने में है, this is 0.32, but because clearance हमारा मिनट में आता है, so this is per minute. The milligrams is per minute. We don't want it in minutes. You are wanting to try कि every 6 hours. पहले हम आवर में पहुंचेंगे, फिर हम 6 आवर में जाएंगे। सो आवर के लिए क्या करना पड़ेगा, 0.32 मल्टीप्लाइड बाय 60। ठीक है, सो अप्रोक्सीमेटली दिस इज 19.2 मिलीग्राम पर आवर। अब इसको हमने करना है 6 आवर्स में। एवरी 6 आवर्स कितना चाहिए, ये एवरी आवर है, सो एवरी 6 आवर्स का मतलब है 19.2 यू मल्टीप्लाइड बाय 6। So whatever the answer, I guess approximately, अगर आप calculate 12, this one is 115.2. So this much milligrams every 6 hours will be the answer. So again, it's not a very difficult numerical. The only thing you have to take care of again are your units. Units need to be uniform, and you see कि answer उसने minutes में पूछा है कि hours में पूछा है. So you will have to change the units accordingly, right? Okay, now the last one is initial plasma concentration of a drug given IV at 7 a.m. is 500 milligrams, ठीक है, per liter. If half-life of the drug is 3 hours and it follows first order kinetics, what will be the plasma concentration at 7 p.m. on the same day? ठीक है, so 7 p.m. on the same day, सुबह 7 बजे ड्रग दी गई है, शाम को 7 बजे उसकी कॉन्सेंट्रेशन कितनी होगी। तो कितना टाइम हमारे पास है, ऑलमोस्ट 12 घंटे। ठीक है, सो हमने कितनी ड्रग दी है 7 AM में, 500, लाइक द प्लाज्मा कॉन्सेंट्रेशन इज हाउ मच, सॉरी 5 मिलीग्राम पर लीटर। अब हमें 7 PM तक देखना है उसकी कितनी रहती है, और कितना टाइम है ये 12 आवर्स का। अब 12 आवर्स में इसकी हाफ लाइफ, जबकि कॉन्सेंट्रेशन गोज टू हाफ, so इसकी concentration will be half, that is 250 in 3 hours। ठीक है, so अब हम देखेंगे कि इस 12 hours में कितनी हाफ लाइव्स आती हैं। so सिंपल है, 12 को आप डिवाइड करो 3 से, so 4 हाफ लाइव्स आएंगी। so 4 टाइम्स 3-3 घंटे का गैप आएगा, 3-3 घंटा, और 3 घंटा इज 1 हाफ लाइफ, तो 4 हाफ लाइव्स आ गई। so फर्स्ट 3 घंटे में और फर्स्ट हाफ लाइफ में 250 बना, हमें 4 हाफ लाइफ्स कैलकुलेट करनी है। सेकेंड हाफ लाइफ में फिर हाफ करेंगे इसको, 125 बना। थर्ड हाफ लाइफ में, दैट दिस इज अनदर 3 आवर्स, दिस इज अनदर 3 आवर्स, अगेन इट विल गो डाउन बाय हाफ, इट इज 62.5। देन इन द नेक्स्ट 3 आवर्स अगेन इट विल गो डाउन बाय हाफ, विच इज नाउ अप्रॉक्स 31.25 milligrams per liter. So you see 3 plus 3, 6, 7, 9, 10 and 12 घंटे के बाद this is the concentration. And why we are so sure? Because why we are deducting 50% every time? Because it's following first order kinetic. A constant fraction of the drug is being eliminated. So 50% half-life का मतलब है when the concentration goes, it's half as it was originally. So it is 500 से 250 हो गए 3 hours में. Again another 3 hours 125, another 3 hours 62.5, right? And another 3 hours 31.25. So 4 half-lives में ultimately what we have is this. So this is all about the various calculations in. There are so many more, but these are the important ones. And again, I would like to highlight on what you should know basically are the formulas. So formulas you need to memorize. So जैसे ये formula है volume distribution, very important, काफी बार पूछते हैं. So you have to apply the formula. Volume of distribution is equal to the amount of drug divided by the plasma concentration. Again, and if there is an oral drug, then you multiply by bioavailability also. Then same is here. And then half-life का formula you should know. 0.693 multiplied by volume of distribution divided by the clearance. And please look that all your units are uniform. Okay? Then again important is loading dose formula, maintenance dose. So loading dose होता है कि जब हमें जो हम dose देते हैं to get to a certain steady state level. Like we want हमें emergency में चाहिए एक level patient को treat करने के लिए. So we have to give a large amount of drug so that it achieves its steady state concentration immediately. तो कईयों की actually half lives होती हैं 5-6 घंटे and हमें emergency में we want action within minutes, right? And how can we achieve that action? Until unless we give large amount of drug so that the level जो हमें चाहिए उस drug का body में वो फटाफट आ जाए. So that is your loading dose. You're loading the body with the drug to achieve that particular concentration, and it doesn't depend on clearance. It depends कि कितनी distribute हो रही है and what is the concentration, plasma concentration. So that depends on these two factors. So if you have these two factors with you in the numerical, your problem is solved. But the only thing is you need to be careful about the values. Maintenance dose. Maintenance dose is another important thing. इसमें आपको याद रखना है, it always depends upon the clearance. So इसमें volume distribution की जगह आपका clearance आ जाए. Clearance is more important in men because उतना ही gap कि आप उतनी drug दे रहे हो और उतनी drug clear हो रही है. कौन सी आपने दिया drug ताकि वो जो already steady state level आ चुका है अब उसको maintain करना है. Then the last one is very simple. You should understand the numerical that what is asking is कि because ये first half life और first order kinetics follow करिए तो half life constant ही है उसका, first half life change नहीं होता है. So half life 3 hours के बाद 50% of the drug is being eliminated. So whatever is left after the end of 4 half lives is your 31.25. As simple as that, right? I hope you could make out some, or you could take some important points from this particular lecture. So if you like the lecture, please subscribe and like. And yes, I keep on uploading new videos every Wednesday and Saturday. So do look out for that. And if you want to access my course, please go to drdeepikatikoo.com and register and join my WhatsApp group. Thank you so much.